Overlapping fears, similarities between panic and anxiety attacks. Panic attacks and anxiety attacks. Both can leave you feeling afraid and overwhelmed. It's easy to confuse the two as they share common ground. Both can trigger a racing heart, that feeling of breathlessness, and even dizziness. These physical symptoms are often accompanied by intrusive thoughts, making it hard to focus on anything else. The feeling of dread is a common thread. This feeling can be so intense that it interferes with daily life. Simple tasks can feel impossible. The fear, whether stemming from a panic attack or an anxiety attack, is real and valid. Both panic and anxiety attacks often stem from a perceived threat. This threat may not be real, but the fear it generates is very much so. This perceived danger triggers the body's fight-or-flight response. That's what leads to the physical symptoms like sweating, trembling, and muscle tension. This shared sense of urgency is another similarity. There's a feeling of needing to escape the situation immediately. This urgency can lead to avoidance behaviors, as individuals try to prevent future attacks. Sudden storm versus gathering clouds. Distinguishing onset and duration. While both panic and anxiety attacks share similarities, they differ significantly in their onset and duration. Panic attacks are like sudden storms, appearing seemingly out of nowhere. They are abrupt and intense, reaching their peak within minutes. The good news is that they tend to be short-lived, usually subsiding within 20 to 30 minutes. Anxiety attacks, on the other hand, are more like gathering clouds. They build gradually, often in response to a specific stressor. You might feel the tension rising slowly. This buildup can continue for hours, days, or even weeks. The duration of an anxiety attack is also typically longer than a panic attack. It can linger long after the initial trigger. This extended period of anxiety can be incredibly draining, both physically and emotionally. The key difference lies in the immediacy and intensity. Panic attacks are sudden and overwhelming, while anxiety attacks develop gradually and persist. Recognizing these differences is crucial for understanding and managing each type of attack. Unmasking the triggers, specific versus unexpected causes. Understanding the triggers is crucial for managing both panic and anxiety attacks. However, pinning down the exact cause can be tricky. Panic attacks are often described as coming out of the blue. There might not be an obvious trigger, which can make them even more frightening. Anxiety attacks, however, are usually linked to a specific stressor. This could be an upcoming presentation, a job interview, or a relationship conflict. Identifying these triggers is a crucial step in managing anxiety. For some, certain situations can trigger both panic and anxiety attacks. Public speaking, social events, or even just being in a crowded place can evoke fear and discomfort. These situations often tap into underlying fears of judgment or scrutiny. While external triggers play a role, internal factors are important too. Negative thought patterns, low self-esteem, and even genetics can contribute to both types of attacks. Understanding these internal triggers can empower you to challenge and manage them. Section 4. Navigating the storm. Effective coping mechanisms. When a panic or anxiety attack hits, it's easy to feel overwhelmed. Remember, you are not alone, and there are strategies to regain control. One of the most effective techniques is deep breathing. Focus on your breath, inhaling slowly and deeply through your nose, and exhaling slowly through your mouth. Grounding techniques can also be incredibly helpful. The 5-4-3-2-1 method is a popular one. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This exercise helps bring your focus to the present moment. Another helpful technique is to engage in gentle movement. Even a short walk or some light stretching can help release tension. Physical activity can shift your focus away from the attack and towards your body. Don't hesitate to reach out to a trusted friend or family member. Talking to someone and vocalizing your fears can be incredibly helpful. Remember, you are not alone in this journey. Section 5. Seeking a guiding light. When professional help is crucial. While self-help techniques can be helpful, professional guidance is sometimes needed. If panic or anxiety attacks are frequent or interfering with your daily life, it's essential to seek professional help. A therapist can provide you with the tools and techniques to manage your anxiety. They can help you identify your triggers, challenge negative thought patterns, and develop healthy coping mechanisms. Don't hesitate to reach out to your doctor or a mental health professional. They can assess your situation and recommend the best course of action. This might involve therapy, medication, or a combination of both. Remember, seeking professional help is a sign of strength, not weakness. It shows that you are committed to your well-being and taking proactive steps to manage your mental health. Section 6. Embracing calm, a journey towards well-being. Managing panic and anxiety attacks is a journey, not a destination. It's about learning to ride the waves of anxiety and find your way back to calmer waters. Remember, you are not defined by your anxiety. Be kind to yourself, practice self-compassion, and celebrate your progress. Every step you take towards managing your anxiety is a step towards a happier, healthier you. It's important to remember that there is hope. With the right tools and support, you can regain control of your anxiety and live a full and meaningful life.